is being recorded.
We recognize this is a challenging time for all of us in children's services across the country, most especially for the families and youth that we serve. We have created these conversations for peer-to-peer opportunities. That's for you to talk with one another as well as the presenters. So we do encourage you to use the chat box. I see you all are very good at that, to share your thoughts and resources throughout today's discussion, as well as questions for the presenters. Again, this is very much a conversation. You're going to be seeing presenters joining us today from their homes, and we will not be using a PowerPoint during the discussion. We will give you a link with a PowerPoint that does have some information, as well as a link for other resources. And we will be sending that information out in follow-up to today's discussion. As I said, this series is truly about managing now for a better tomorrow. Together, we are stronger in creating forward-looking solutions to meet the challenges of today while building a brighter tomorrow. And we do value your participation in today's discussion. And we're going to especially need you today as the East Coast is experiencing severe thunderstorms and high winds. So we may have some technology challenges. So if you lose us, please stay with us. Please log back in. If we lose you, please stay with us. We have a troubleshooting team ready to assist you with backup plans. As I mentioned, today's conversation is part of a series. We have recordings of previously held conversations on crisis communications. We held 2 of those conversations on March 25th and March 31st, and those recordings are available on our website. We also had a very robust conversation on in-home behavioral health. 2 of our presenters today, Dr. Christopher Belanci and Liz Manley, were part of those discussions, and that one was held on March 26th. We have some upcoming discussions, one on residential treatment facilities taking place tomorrow at 2 p.m. Eastern Time. The infant and early childhood mental health on April 14th at 3:30 Eastern Time, and our newest mobile response and stabilization that'll take place on April 16th at 3:30. Additionally, as Tiara mentioned, we've had an overwhelming response and we reached our maximum capacity for today's discussion. So we've added another one on supporting families that will take place on April 13th at 3:30 p.m. We also have some additional discussions that will be coming up. Please watch for dates that will be advertised in the TA Telegram. They are supporting tribal communities and housing instability and homelessness. If you would like to sign up for conversations and resources, please visit our website at theinstitute.universityofmaryland.edu/COVID-19. You'll see additional information about the upcoming discussions as well. Today's conversation is about supporting families during COVID-19. And we're proud to present today with our colleagues at the Family Run Executive Director Leadership Association, FREDLA. Today, joining us will be Pat Hunt, the Executive Director, Millie Sweeney, the Deputy Director. She will be facilitating today's discussion, so we'll be watching that chat box carefully for your questions that Millie will bring forward to our presenters, and Jane Walker, who's a Senior Advisor and former Executive Director at the Family Run Executive Director Leadership Association. Also joining us today is Liz Manley. Liz Manley is with us at the Institute for Innovation and Implementation at the University of Maryland School of Social Work. Liz is a clinical instructor. She leads our workforce and clinical work as part of the TA network, and she's also the lead technical assistance consultant for several states. Also joining us is Christopher Belanci. Dr. Belanci acts as our medical director for the TA network. He joins us from the Judge Baker Children's Center at Harvard Medical School. And with that, I'm going to turn this over to our presenters.
Thank you, Denise. FREDLA is delighted to facilitate this most timely conversation, and we're particularly grateful to the University of Maryland's Institute for Innovation and Implementation for hosting this call. We are somewhat awestruck with the turnout for this call and are delighted that so many of you are joining us today. I am Pat Hunt, the Executive Director of FREDLA, which is a national network of family-run organizations that are supporting families caring for a child, youth, or young adult with mental health needs. I really want to thank my colleagues, Jane and Millie, and our deepest appreciation to Dr. Balanci and Liz Manley for joining us this afternoon. We will get to as many questions as we can during this time frame, but we're not going to leave you in sort of hanging out there. So we'll make sure that we follow up with the answers and that they'll be available to you beyond today. So we want to say that often presentations end with a thank you. But we want to begin this conversation with a giant thank you to family-run organizations responding with creativity, to parent peer support providers for being dedicated, undaunted, and on the front line with families throughout these concerning times, to providers, administrators, and policymakers for supporting families and the organizations that serve them. Because over the past few weeks, we've had contact with many family-run organizations and family leaders across the country. They have told us about the wonderful things they're doing and the wonderful things that you are doing. We are so impressed by the dedication and adaptability of organizations and parent peer support providers to continue serving families and youth with creativity, humor, and never-ending skill. We also know that these family leaders are also juggling the needs of their own families in the midst of serving other families. And we know that all of you who have joined us today are doing the same. You're probably, those of you who have children are probably in the middle of a classroom right now as well. So thank you for being flexible and creative. So we really want to begin by acknowledging this amazing work and thanking everyone for going above and beyond to serve and support the families you work with, and to say that we know you have also taken on new responsibilities, and we deeply appreciate you joining us today. If you look out the window today, it seems normal. In some places, spring is in the air. However, as I look out my window, we're getting gigantic snowflakes, which are promised to be at least 8 inches deep by tomorrow morning. In the last 30 days, life as we have experienced it has been unprecedented in its changes, and that has had an impact on our daily lives. Our ability to shop, go to school, work, travel, visit friends, worship, and participate in recreation are missing. Our natural inclinations to be together are now discouraged, if not forbidden. One family member has said, in our family, we hug all the time. I miss hugging and a sense of touch. Instead, we have daily reports of numbers of people with the virus, the number of fatalities. Masks and gloves and hand sanitizer have become household staples when and if you can get them. Even in the best of circumstances, families struggle with confinement and managing daily life. Families caring for a child, youth, or young adult have additional stressors and concerns. And I don't know about many of you, but I'm sort of reminded during this time when we can't go places of when I was really young and my parents had to deal with me when they said that I couldn't go somewhere and all I wanted to do was go somewhere. So, you know, once in a while you are tempted to at least get in your car and take a short drive just to see something different. So we have some themes, what we've heard from families over these past few weeks. And Jane, I'm wondering if you might like to review those for folks today.
Sure, Pat. Just to echo what you've said, it's been astounding to talk with family leaders, family organizations across the country, and see how they are continuing to work with families and support families throughout. Themes that have emerged are utilizing technology to connect with families, identifying accurate information for families and information on how they can access different resources like breakfast or lunch or new store hours or when the bank is open. We're hearing a lot about the strain on just getting adequate food, maintaining shelter, a lot of financial worries, safety and health concerns, a loss of major milestones and celebrations in life, and the impact on emotional well-being, as well as managing home, schooling, and daily responsibilities. If you couple all of these, it's a challenge for any family. And as Pat mentioned, if you particularly have a child or a young adult with mental health needs, you've kind of magnified every one of those issues at least twofold. So if we talk about how family organizations, family leaders, providers are supporting families, technology really is the biggest thing. Obviously, we're doing that right now on this call or conversation. And one of the things that struck us in talking with the organizations is how they have engaged families in designing what that looks like. I was impressed with one group that I spoke to that during spring break, the families decided that what would be helpful to them was a chat for young children earlier in the morning, like 9 o'clock, for adolescents around noon, and then the parents wanted their own group later in the afternoon. The parents really designed how and when they wanted those and the frequency. They wanted it every day during spring break. When spring break was over, the parents said, that was so helpful. We want to continue that, but we can't do it every day. Let's go to every other day. So engaging families in what that support is going to look like. Another organization I spoke with, the family said, we just want a text in the morning to get us off on the right foot. And so that family organization is daily sending out texts that are positive or helpful tips or resources. And then the family said they wanted later in the afternoon a 20-minute chat just to connect with each other and reduce that isolation. So as well as the use of technology is engaging families in how often, what platform, and how to do that. The world now seems to exist on Zoom or maybe WebEx. You've heard of Zoom weddings, birthdays, and Zoom support groups have really mushroomed. People are finding them very effective ways to stay connected and support each other. Zoom PJ parties, happy hours have become a new way for adults, business associates to connect. Currently, there is a letter to Congress that's been signed off by many national mental health organizations to ask for funding to provide support for virtual peer support programs, including support group meetings for individuals with behavioral health needs and substance abuse disorders. So, establishing a way to support financially those support groups is going to be important down the road. Regular phone check-ins for one-to-one support, and we talked about using social media and things like phone trees. So we're wondering how you have engaged families in your programs to design what support looks like online. With that, I would also add helping families to access that technology, helping them learn that technology. We know that many grandparents are raising their grandchildren and may not be as familiar with the technology. I myself own up to that, and I'm constantly calling my grandchildren saying, help me do this or that. So the technology can only be utilized if the families know how and have a means to utilize that technology. So I see comments here about different things that people are doing throughout the country. I'll FaceTime talking to the entire family who sit on the couch together. Somebody very correctly said technology is not readily available for all families. Absolutely. Hopefully, families have an ability to text or have access to a phone. At least having that connection is important. Yeah, and somebody said phone calls and letters, sharing drawings, those kinds of things. Information is another key, and concerns about misinformation, and wondering who you can trust with information. We know that information abounds, and it's really difficult to sort through what's accurate and what's not. So, in supporting families, ensuring that the information is coming from reliable sources, and encouraging families to control the amount of news that is coming into their house. Having whatever news channel on all day, it may not be healthy for anyone in the household. And also helping families explain what is happening to their children in a way that does not terrify them. I was on a call yesterday with a group, and one of the family's members was saying that their children are terrified. They're afraid to sleep at night. They're afraid if their adult or caregiver has to go out to the store, or many times if they're essential workers, they have to go to work. And the children are terrified. So having a way to balance giving them enough information while not creating undue fear. And encouraging parents to calm their children's fears and talk openly about what is happening. The Child Mind Institute, which we have a bunch of resources for you at the end, but they have many very valuable resources for families about talking with their child. I myself have an adult with developmental disabilities, and it's taken me a while to try to explain to her what is going on, that I am not trying to be mean by saying we're not going out, and to show her pictures of what's going on, even around the world, to help her understand what exactly is happening out there. Pat?
I just want to say I noticed a comment that went by. Somebody's said they're using funding from canceled events to purchase technology for families. I think people are sharing some wonderful information in the chat box. Thank you for doing that.
That's terrific. Pat, you want to talk about daily living?
Absolutely. So there's really been a strain on daily living. For some folks, there's unstable or crowded living situations as shelters have closed. We've heard that families have been providing support to families who have been living in cars or living all together in one room at a hotel or a motel. The fact that their children may not have activities to do during the day. And so we all know, I think we've heard of hotels who have really been searching for things to be able to help families not only get through this together, but for children to be able to advance their growth and to have some forms of entertainment and exercise. The inability to get necessities doesn't only relate to having money or having funding. It's that necessities have been scarce. And I know we had some examples, I think it was Florida, where formula was not available in their county or near their home, diapers, pharmacy items. We know food banks In the little town that I live in, they normally serve 50 people, and last week 151 people were served by this food bank. So it's an enormous drain for those of us who have been fortunate enough to continue to work, or to maybe have some time to donate. I think many of us have ponied up and done a little more than we normally would, given the circumstance and the extra burden. Financial concerns around reduced hours, loss of employment, bills that are due and overdue. And I know there are loans and grants and lots of things available to help people, but those don't always get down beyond organizations or companies. And you know, it's a long wait when you don't have what you need for a resource to either keep your power on or to keep food in your home. There are people who are working in fear. They're determined to be important to have working right now, but they're working in fear that they will either catch the virus or bring it home to their families. They're also working in fear or feeling unsafe, that if they bring the situation up to management, that they might not have a job. And so I think fear goes in lots of different directions when we talk about that. And certainly it's become a time of health disparities, as probably many of us have read about the high rates of the virus being in African-American communities and other communities as well. So we're wondering, we'd like to take about 30 seconds here and let you all post in what strategies are you using to cope with stress when you can't access your usual means. So maybe the gym is closed, or you can't do the things that you normally would to relieve your stress. So if you would share some ideas, that would be great. Thank you.
Pat, I wanted to just mention also the issue of financial concerns. In talking with family organizations, they have reported that they feel it's coming, that people may have gotten their last paycheck if they've been laid off, but that the next paycheck may not be coming. And we don't know when the checks from the federal government might arrive. And so there's real concern that maybe the next wave is going to be a critical financial crisis. Organizations are talking about how they can deal with that. Some are diverting funds from other sources. They've gotten permission from their funder to do that, to be able to purchase gift cards for families or other basic necessities, gas for the car, whatever. So
we're getting some great responses to our question.
yeah.
People who are reading, having Skype parties, who are doing yoga outdoors on their porch, who are doing all sorts of things, using free exercise options on TV to be able to do exercise with people, and gardening, cleaning their houses, repairing their homes, doing all kinds of things, baking. I'm glad I don't live next to you. I feel like I am too close to the refrigerator every day as it is. So thank you. So the impact on safety and health. So it's not a surprise that there's been an increase in reports of domestic violence. Additional stressors can increase abuse and neglect. And while there has been an increase in reports, in some areas, isolation can reduce that reporting, and investigation is limited now. People are not going out doing what they normally would do. And access to routine health care or specialized medical care may not be available even, surgeries elective surgeries have been postponed or put off, or you may not even have a date yet. You're all ready for it, and then it gets canceled, and they go, "We'll call you back in July," So go ahead and have a little stress for a few more months about that elective surgery. It's important, I think, to find new ways to have conversations or ask questions of people that you're supporting, because if perpetrators of domestic violence are present and in the room, particularly while you're having conversations or meeting with people, to find new ways to sort of ask those questions about feeling safe, and providing people the resources they need. Access to routine healthcare may be postponed, and making sure families check their child's medication and have health insurance information readily available is key during this time frame as well. And we know families with a child in residential programs or detention programs or group living situation have added worries about the welfare of their child with different shifts coming and going. They're exposed to more people, or they may be exposed to more people who have been out and about doing other things as well. And so really making sure that they get the added support. We hope that those environments, and I guess we'll learn more in future presentations, are looking at ways to keep families as connected and to alleviate their concerns as much as possible. Did you want to talk a little bit about the next one, Jane? Talking about milestones and traditions?
Sure. Before moving on to that, I just wanted to again reiterate about the concerns about children in residential programs or detention, or I have a daughter that's in a residential program, and have to say that it was we really agonized about, could we bring her home? What would be the ramifications if we did? But yet, not that the program was not doing everything it could to keep her safe, but just that we know that there were different shifts of staff. Those staff all had children, that the way the virus is traveling, it can happen very easily. And so we made a decision to bring our daughter home. Not every parent can do that, but those worries continue. And I would encourage people who are supporting families who have a child in residential or detention, and program providers, to really reinforce all of the safety precautions and discuss with families how to really maintain that connection. I know we got an email on a Friday afternoon saying we could no longer visit our daughter or bring her home at all. She didn't know that was coming. We didn't know that was coming. And it was a difficult, shocking event. So again, just how that is implemented is critical. So life goes on, right? In the midst of a pandemic, people have birthdays. There certainly are religious holidays, as we know this week, with Passover and Easter in the same week. We know that many seniors are going to be missing proms, graduations, senior trips. We know many people who had wedding plans. Some are doing them on Zoom. And realistically, we know that many families are experiencing the grief of loss of a loved one. Many from the pandemic, others from just circumstances in life. But how every one of those things has changed as a result of our inability to gather and acknowledge these milestones and celebrate or grieve together. supporting families and helping them find other ways to acknowledge, to celebrate, to grieve is very important, as we all know. We've seen wonderful examples of that, on YouTube and such. And we wondered if you've come across that, and if so, how are you supporting your families and even your staff to celebrate those milestones or deal with the losses? Oh, goodness. I'm just reading one of the comments that came in about the residential treatment program in Nevada. I'm sorry to hear that, but how about recognizing milestones? Anybody want to share on that? See if we have anything coming in on that. I know many people have had to postpone memorial services at this point in time. If a family member is in the hospital, they can't even be with them, which can be very difficult and frightening for people.
So Jean, I was in a community the other day, when I went to do my errands. I went by a place I wondered why so many cars were lined up in a row. And there was a birthday apparently at that home, and they were each tying a balloon to the mailbox as they drove by and waving in the window to a child that was in the window. So it was like a parade of balloons, but they each tied a balloon to the mailbox. So that was just an interesting, like kind of a heartwarming way to see them still acknowledge the birthday. But nobody was getting out at the same time as anyone else, or,
I see someone here says nurses and caregivers who are Skyping with families and their loved ones in the hospital. Yeah. Zoom happy birthday parties. Stark County, Ohio, the Latino community. Drive-by parades. I think a drive-by parade doesn't need a pandemic. I would like that anytime.
Exactly.
Yeah. I'm happy to hand out my address if anybody wants to organize a parade. I think that would be great. So, red ribbon on your porches, signifying prayers. Oh, that's beautiful. Yeah.
Great example.
There's a question here about flexibilities from SAMHSA for us to be able to creatively address the needs of families and children to address disparities. For example, some families cannot qualify for free or reduced Wi-Fi due to unpaid bills. Anybody from the Institute or the TA network on the call might be able to address that question? Any accommodations that SAMHSA might make?
Hi, Jane. This is Denise.
Yeah.
SAMHSA has released guidance on flexibilities given to grantees, so I can post that link. And as always, your first stop is going and discussing those requests with your government project officer. But I'll post that in a few.
Great. Cruise night. Very good. Great ideas. Oh, the fire department even came out. That's great. Yeah.
That's wonderful. Go ahead, Jane.
So in the midst of this and with families being confined, there are also added responsibilities that lead to burnout. It's a real strain on emotional well-being for all of us, even under a family that does not even have a child with any particular special needs. We're all experiencing that strain. I'm sure everybody on this call can relate to the strain that you have. So it's important to, we know, everybody on the call, I'm sure, take care of yourself and find ways to share the burden. The lack of sleep, the lack of socialization resulting in isolation, um, ensuring that you maintain good nutrition, find some form of exercise. I was on a call also yesterday when there was a grandmother who was working with her, caring for her grandchildren, and tried to implement an exercise program with the kids and was telling them, let's go and we're going to run around the block. And the grandchild turned to her and said, I don't like your recess. So I think she was trying to do it in the context of homeschooling, and the child said, I don't like your recess. So trying to implement exercise activities and address the fear, anxiety, depression, and trauma. And unfortunately, we know there have been increases in suicide that can be expected during times of isolation. Be prepared to support people who need it, listen keenly, help people feel connected, and prepare for prevention, intervention, and if necessary, postvention. So, Christopher, did you want to add anything along these lines?
I want to start by unmuting myself. Thank you
Thank
for this rich conversation and for the privilege to be part of the conversation we're having today. I think this is an unprecedented time, and I think we just need to acknowledge that there's no rule book for a pandemic, certainly not one that we've ever experienced. And so I think we need to start by allowing a lot of forgiveness, because invariably we're going to get a lot of things wrong, and we're going to get on each other's nerves as we're all confined into our close quarters. We made the decision to fly my mom up from Florida because I was concerned. She's 83 years old and her 82-year-old boyfriend was not socially distancing. And while it's been lovely to have her near, and I feel great that I'm able to help keep her safe, it's not been the easiest time. It's been a long time since we've both lived under the same roof. And so, we've had to acknowledge that this is an unprecedented and unusual circumstance, and be generous in our forgiveness of each other as we figure out life together again after many, many years of living apart. So, I think starting with the recognition that we're all having to kind of find our way. And what I love about what's happening in the chat is so much sharing of innovative ways of remaining engaged, staying positive, knowing that while this is very stressful, there will be an end to this, that there is a light at the end of the tunnel, and looking for those kind of positive signs in the news and in our communities. And I try to focus on those, because there's lots of things to focus on in the negative, and it's not that we want to be immune to the news. I just think we need to take it in small doses and in manageable ways, and make sure that we're buffering our children from the litany of negative reports and death tolls and coronavirus new infection rates, and be able to identify some positive news in small ways. Mr. Rogers reminded us to look for the helpers as promising signs of good times ahead. And, and the helpers are the people who are still going to work every day at the local Stop and Shop and checking our groceries out and risking their lives to do so for relatively low pay. Helpers are the mailmen that are still delivering our mail, and the garbage men who are still picking up our garbage, and of course the medical providers who are at the very front line, often without the protective equipment they need to keep themselves safe. So there's acts of heroism going on every day in small and certainly more meaningful ways, and I think that's the kind of positiveness that I want to make sure that we're sharing with children and with ourselves to draw strength from those experiences and that bravery.
I love some of the words that you used in terms of bravery, and I think you used the generous spirit. All very, very positive takes on what's going on right now. That's good.
I think it would be nice to pose a question for the chat box now of share one of the most positive things that you've seen happen during this time frame. Because I know when we did that with one of our family calls, we got some phenomenal response. And so I'd love to hear from folks on this call. And it looks like there are over 600 of you on here now. So if we could get some idea from you about some of the best things that you've seen happen.
Mhm. Yale University has an online course that is free on well-being. And she talks about 5 things that you can do right now for your own well-being. And Christopher, you touched on several of them. One of them she talks about is deep breathing. Just pause and breathe deeply, and just kind of relax your whole body. She had a scientific reason for that, which I don't recall, but she just talked about just pausing several times during the day to take deep breaths. She, of course, talked about, eating right, sleeping right. But she talked about gratitude. She talked I think you touched on that, appreciating what there is and recognizing, whether it's a flower that you come across and notice the beauty of it, whether it's a kindness of someone that you observed, whether it's somebody that just called to say hi, and just being grateful for that. As peer support providers, as individuals who work with families who are often stressed to the max, you in your role may be the single thing that family is most grateful for today. You may be that person that called. You may be their lifeline that day. That if they were to write their gratitude journal, you would be at the top of the list that day. And it's important for you to keep the importance of your role in mind throughout this period, as you also recognize the things that you as an individual can also be grateful for. The other thing that they mentioned was giving back. And sometimes I've observed that families who are needy sometimes don't think about giving back. And that practice itself can be very empowering and really foster well-being. So just encouraging children and families to think about somebody else. Oh, let's call, grandma, or let's make a sign and walk over to our neighbor and knock on the window and hold it up. We're thinking about you, but just to turn outward at this time instead of inward. So I thought those were very helpful suggestions.
Yeah. And focusing on what you can control rather than all of this stuff that is so out of your control.
Right. Yeah. Another good point. So free, and I don't have the link for it right now, but
I think someone put it up.
oh, great. It could even be used with a support group to go through the course as people individually listen to it, then get on as a discussion, or peer support providers could use it, providers could use it, and then translate that with the families there. Very simple practice to improve well-being. Okay. Okay, managing homeschooling and daily responsibilities. So a lot of us did not ever intend to be teachers, but in today, it's become part of the role of parents to also be teachers. And monitoring their children's academic needs can become very stressful and an additional burden for families. Other families report receiving little in the way of guidance or materials from the school. And homeschooling may be particularly challenging for a child who has special needs and maybe had an IEP at school. I think one of our Fredless staff members said it well that, you can under these circumstances and, you're not expected to be a teacher. So helping parents put realistic expectations on the whole homeschooling framework there and encouraging families to set up a structure at home. Summer is a relaxed time when schedules are less rigid. However, we're only in April and children are supposed to be in school now, but they will not be for in some states for a very long period of time. So helping families establish a routine that help parents and caregivers feel some control and also helps children understand expectations more clearly. Making sure children have activities and can get exercise can be challenging in apartments or neighborhoods where playgrounds are closed, where there's, do not enter signs on playgrounds. We were struck when we were on the phone with one family leader who was talking about the challenges for the families she's working with who are in one-room motels and how challenging that is with an entire family in one room for this length of time. Self-isolating has unique challenges for different age groups. Younger children may need more supervision, kind of channeling their energy in appropriate ways, while the reverse may be true for older children who may want to isolate, feel like they can spend the day in bed, want to spend the entire day on their screens. And often there's a lot of sibling challenges, which can be exhausting for parents and can set off major in-home battles. I was reading the paper this morning, and in our paper on Thursdays, there's a parenting column by a parent coach. And she had many questions today from families about this kind of thing, about dealing with isolation and the children being home and trying to manage all of it. And one family wrote and said, "My child keeps calling me names." And the coach wrote back and said, I may be responding from this more in my role as an exhausted mother of 3 than as a parent coach. But pick your battles, walk away when you can, and just know that there's going to be good days and bad days. And I think that coming from an exhausted mother of 3 with 3 kids at home, she was probably right on target there. Pick your battles, walk away when you can, and know that there's going to be good days and bad days. Working from home has now added a lot of stress for some families. Trying to work and minimize interruptions from children, dogs barking, kids coming in asking, I'm hungry, when are we going to have lunch? Those kinds of things. On the other hand, I feel like that really has leveled the playing field in many ways, and it's helped us all to see each other as more human, and to be more forgiving. I think that's another thing that Christopher mentioned, the forgiveness part. And I think we have examples. I mean, I have to say, I'm astounded at all of the television personalities who are, now doing broadcasting from their homes, and their children are interrupting and their dogs are jumping in and stuff. And it, some ways, has really made us all much more human in that way. The other stressor in daily life is really being very conscientious about the health protocols to prevent the virus in their homes, and helping children to be vigilant about hand washing and attentive to contact with other people and with anything that may be brought into the home, which is another very real concern and added burden. And likewise, families may also be alarmed with every, cough or sneeze or I don't feel well, which could be just ordinary, colds or hay fever or allergies. And yet now, with this virus looming over everybody, this invisible, I feel like we're all living in a sci-fi movie. You begin to wonder, okay, is this the start of something? So it again puts everybody on edge more than we would be. So, Pat?
Right, yes. So we've also heard about lots of changes in processes and practices and protocols. So it appears that business meetings are taking on a new norm, as high-level business meetings are being interrupted by homework questions, fussy babies, barking dogs, or whatever else is going on. And people's daily lives are being accepted into multinational discussions of strategy and product development, mergers and acquisitions. It's a whole new world. So I think Jane has spoken with our staff about some of her family's examples in that as very real, and how it has taken sort of the indoctrinated humanity into everybody's life here. So it's changed how you do your work. There've been relaxed regulations and amended contracts and new reporting structures and new expectations. I think some of the family-run organizations have been able to adapt very readily because their infrastructure was already at a point where they could do their work more virtually than others. Others have struggled or may not have had the resources to be able to do that. It's also changed when you do your work. When are you available and when are families available? And I've been thinking about that a lot as I think about practitioners and providers feeling like they have to have a particular set of hours in which to support a family. However, they also are, or many of them are also doing homeschooling and other things during those hours now. So, so what does that look like? And have you had conversations with families around when is a better time of day for you, and maybe thinking about doing your homeschooling during the day and offering those sort of office hour type approaches later or very early. And also how staff are being supported. And I know for some of the family-run organizations, that sort of having that little check-in couple times a day, maybe an early morning staff meeting for a half hour, or sending pictures back and forth, like this is my amaryllis and here's in what stage of blossoming it's at today, or my Easter cactus or whatever, sharing different little things like that back and forth during the day, just as a way to stay in touch and say we haven't forgotten about you, has been really key to them. So the question we would like to pose is, what significant changes have you or has your organization made to how you do your work, when you do your work, or how staff is supported? So we'll wait a minute while we see your response to that. Did any of our other presenters want to weigh in on this as well? Want to talk about this topic, about relaxed regulations or amending contracts, or any examples that you might want to share?
I do want to go check out the Go Outside and Howl group.
Yeah.
Facebook. That's intriguing. Yeah.
Exactly.
Well, for those of you that are working with families directly, obviously that's very challenging right now as we try to socially distance. One of the things that the government has loosened up are the requirements around HIPAA, which is the Health Insurance Portability and Accountability Act. So some of the technologies that we use for telehealth or connecting to clients are not HIPAA compliant, but the federal government has relaxed those HIPAA compliancy rules so that you are able to use technologies that aren't officially HIPAA compliant. And I know there's lots of chat early on about folks working in rural areas where internet access is more limited. And so that's where I was saying, you know, if you have a landline, you can certainly even use phones. I live in a rural area and have to go to a friend's to be on this call because I can't get Comcast broadband where I am. And so I've been calling into most of the meetings that I'm participating in, and telephones are certainly amenable to that kind of outreach with clients. And a lot of people are using text, and that came up in the chat box too. You know, these are unprecedented times, and so I think there'll be some forgiveness for actions that are being taken in the best interest of all the families you're working with.
Thank you. Thank you, Dr. Belanci. Liz, not to call you out, we haven't forgotten that you're on the call today. I wondered if you have any thoughts around changes in process or protocols, or any of the things that we've been talking about. I just certainly wanted to give you time to weigh in if you have something.
Yeah, the first thing I wanted to say is that there's a lot of information that's already posted on the Institute's website around some of the changes that states have made in order to address the real needs of shifting quickly to virtual. I do think that many communities have been able to shift their practice to move to using virtual tools. And just a couple of things that we've been thinking about. One is that it's really helpful, I think, and important to remember a few really important things, like number one, people can see your house and see your stuff, so you should protect it. Two, we should let folks know that we can see into their homes too, and so it'd be important to protect there as well. And I think another really important thing is to remember that it's a different dynamic, but it's an important shift in the way that we communicate, right? So making sure that we're attentive to these shifts and changes that are really different in using virtual technology. Also, we've been talking about in the places in which virtual is not available, as Christopher was talking about, and really trying to be creative around getting to as close to face as possible. The telephonic is helpful, but it's important to stay connected and make sure that you know, if there are virtual tools to shift to, then that's the preference. If there are not, the primary purpose of staying connected. and engaged in any way that we can stay connected and engaged. So thank you.
Very good. Very good.
If I could add to that, this is Millie with Fredla. One of the things that I've heard from one state is their contractors are helping out the family-run organizations and those that are doing this work directly with families by adjusting their contract. Instead of it being a reimbursement situation, they are paying them in advance so that they can pay their workforce. And then they are also streamlining some of the reporting requirements. So during this time, they've amended the contract, the way they're paid and the way they report, so that they can get services to families much more quickly.
Right.
And I think some are also flexing the deliverables in terms of, target number of families to be served, recognizing that, when you're limited as we are now in terms of, providing one-to-one support or things like that, so they are being more forgiving in terms of, if you don't meet your target under this contract, that it's okay for now.
While we're on this topic, I see a question that says, are there any national efforts to get Medicaid requirements standardized across all states? Does anybody have any response to that?
If you've seen one Medicaid plan, you've seen one Medicaid plan.
Medicaid, yeah.
Right.
I don't think that's going to happen.
No, I think that the best efforts have been in the SAMHSA CMS joint bulletins to the state directors, which happened in 2013. But I do think that there is some consensus right now around easing up and as much as possible around the ability for folks to communicate. So I think there's some consensus, I think, around that piece for many states, not all, but for many states.
I also think this is an opportunity for advocacy, because I think some of the interventions and the flexibility that some of the institutions are taking in response to the pandemic may become the new normal.
I agree.
And I think that can have great potential benefit for thinking completely differently about the way we deliver services. And so while this is a crisis, there are opportunities in crises to think differently about the way we do our work. And so I really would encourage you to reach out to your legislators and your governor to be thinking about exactly those actions. Massachusetts has actually increased reimbursement rates by 10% because they want to ensure that when the pandemic is over, there will be a network of supported providers and practitioners and folks doing all of this critically important work. And so while other states are going to certainly be looking at the concerns about tax revenues and what the unemployment rates and the economy is going to do, I still think that there are opportunities to be strong advocates about the needs of children with behavioral health disorders.
Christopher, I think you're absolutely right about the advocacy piece. And let's just remember that there are the federal rules and then there are state rules. And so there's a ton that's allowable within the federal rules. And so the advocacy really is around states to open up as much as possible. And I know Denise just posted the link to the clickable map, which is really helpful in seeing the creativity from around the country around what folks are really trying to do to get there. But the other piece of that is it's really important to pay attention to what's working, right? And be able to tell the story of how important these connections were in keeping children from escalating to a place in which they needed more intensive services and all kinds of other things that I think are important to pay attention to during this time. So tracking your data of your baseline of where you are is just really important as well.
Thank you.
Yeah, Liz, I agree
Pat?
with you. Oh, sorry, Pat.
Sorry, Jane. I was just going to say we are closing in on time and we have a number of questions.
Well, I
so
was
wonder if
just going to that. Thank you. Perfect timing.
So we have some, I've been trying to group some of the questions that we've gotten in. But first of all, the chat will be included for everyone who's participating. So that will be sent out along with resources. There's also a copy of an extended PowerPoint for this so that you have some of the information we've talked about, and a link to a resource list for kids, for parents, for supporting families, and for organizations. There's four different categories. Some of the questions that we've gotten, we've touched on a little bit, but families not taking this seriously, not taking precautions, and how can they do that when they can't access certain things? And kind of with that, and we may have a couple of people weigh in on this, what happens when you have staff who, for fears for themselves, aren't able or willing to go and do some of the things that would be helpful to families? Being able to delegate those things, some of those things to staff. So any suggestions around that? From anyone on the panel?
So the first part was working with families who may not recognize the seriousness of the pandemic. Yeah.
Mm-hmm.
Well, that's a tough one, obviously. And it relates to the information people are getting. And I think helping people get the accurate information and explaining to them how this virus has spread around the world, not just here. I think there is some maybe false sense of security in some areas that it has not hit as hard as, say, the New York area, and trying to explain how that may, prevention may help that doesn't happen in their area. And is really the only, and education, the only way to kind of combat that.
The CDC has some great infographics that are wonderful for families to understand, that if you keep in mind, when you go out, it's not necessarily protecting you from other people, you're protecting others by not going out or by wearing a mask or by having one person or having some type of protocol. My husband still works outside the house. He comes in and all of his clothes are in the garage, and we leave them there for 24 hours, and then he immediately showers, just taking some of those steps that might be possible, and using some of those infographics with families, I think, would be helpful.
Yeah, I would add that, a lot of folks are steeped in denial. Can you hear me?
Yes.
And so, some folks respond to information. And I think one of the things that people need to know is even young people are getting sick. 20% of the hospitalizations are in young people aged 20 to 44. And so while they may not be dying and they may not end up on ventilators, they're getting sick enough that they're using up the space and capacity that we need for the people who otherwise are going to die without that intervention. And so I think it's important to frame it that even if you're not worried about your own safety, think about your grandparents, think about other people's loved ones, because your actions are going to have an impact. We don't have a treatment for this virus, and we don't have a vaccine to prevent the spread of this virus. The only thing we have control over is how we respond to the virus. And so in order for us to beat this virus, we have to take personal responsibility for our actions, and we need to socially distance. That's the one tool we have until we come up with other treatments or a vaccine. So until that happens, I think it's just critically important to remind people why this is so important and not a laughing matter, and it needs to be taken seriously. And I think trying to convey that not in an angry way, but in a dispassionate but forceful way, I think is really going to be the key to engage some of those families that, for a whole host of reasons, are perhaps engaged in some level of denial about the danger that this poses to all of us.
I think
And I
another,
think we've also seen, some of our political leaders also do the same. Some governors, and other people too. So it's like, I don't want to feel like it's limited to families, but I feel like sometimes the systems reflect one another, you know?
Mhm.
So,
I was also going to suggest that many of the celebrities, if you will, are doing PSAs, and that some may resonate with families more than, say, a governor or the head of CDC or something, and trying to find some of those PSAs. Some have been just wonderful in terms of communicating the importance of social distancing and health protocols. So
Mhm.
if showing a family an infographic from the CDC may not be as because there may be suspicion about who did this and what's their underlying motive, but someone that they may admire from sports uh, uh, um, or from movies or whatever could be something that might influence.
Mhm.
another question?
Somewhat similar to that, um, any suggestions or strategies about when the helpers are affected and then they're not necessarily there to be able to help? So I think there's a couple of layers to that. It's for your own staff, but what about the families when there isn't someone they have relied on is not able to help anymore?
Well, organizations should have a plan to um, ensure there is coverage or is um, staffing. It's not ideal, but it's better than having somebody, uh, kind of left um, behind. So I think that's incumbent on the organization to have a plan in place for those instances to cover that.
More of a basic needs question. How to help families who are quarantined that don't have the financial means to get things delivered, like food or any other basic needs?
I think we're going to see more and more of that. Yes. Yes.
We are going to see more of it. I think, making sure that all of our staff, not some agencies don't have parent peer support workers. Some agencies don't have, community liaisons or whatever, who are really attuned to the resources that are available in the community. And just making sure that all of the staff are aware of what resources do exist, and to help families reach out to those resources, whether it's to help pay their light bills so they can afford food, whether it's to help with food and other important items. So I think that's key. Sometimes we leave it to that one staff person whose job it is, but they're home teaching their kids now too. So if we all sort of shoulder the load a little, it makes sure that all the families get the information that they need.
Yeah, one organization I spoke to said they had developed new partnerships with churches and food banks and things to be able to, that they themselves were not able to do that, but that they were partnering to make sure their families were on a list to be able to get food through the local churches or food banks and things. Yeah.
There's some great ideas coming through on the chat as well, about different organizations that are helping, like Catholic Charities, the Next Door app, like you said, food banks, churches, there's Facebook groups, there's community groups that are doing shopping for people. Just letting them know when's the best time to go. There are senior hours, for those that are more vulnerable to this. There are certain times you can go to stores. where they blocked everybody else out, so you're less at risk. So another specific question, if you're going to be doing Zoom type things for youth and for children, are there any topics that are suggested for teens and also for those under 12 to keep them engaged? I will say on the resource list that we posted, there are a number of different activities that are available.
Yeah, and I think that resource list is a great resource list for folks to sort of navigate through when you have a little time to do that, because it certainly does offer a variety of things, a variety of options for a variety of ages. So make sure that you do download that link.
Yeah, it's amazing. A lot of children's book authors are reading to kids, illustrators. I love the doodle guy that is doing an online doodle class every day at noon with kids, which is getting huge turnout. So there are many resources that are now available online.
Rita shared some ideas: Mindful Mondays, Show and Tell Tuesdays, Wacky Wear Wednesday, Thinking Thursday, and Fun Friday. So having theme days.
Oh, perfect.
There's options to watch a movie together and discuss it through Netflix.
That's great.
There's a number of things. There's also a suggestion. It is Child Abuse Prevention Month. Thank you for that reminder, because it is. Yeah. Important to remind children different ways they can report concerns, especially since they're not around those who are mandated reporters as much. See if there is another one in the last couple of minutes.
And that's
some questions around. Oh, go ahead. No, go, Chris.
I was just going to say that that's coming up as well in terms of people doing more telehealth. In some ways, you're having windows into folks' homes, and you may hear things in the background or see things that may raise a concern and require a report. Reporting is down at most child abuse hotlines by as much as 50%. Schools are responsible for about 20% of child abuse reports, and so without that contact, we're not getting those reports, although we would anticipate that those concerns haven't gone away and may actually have been increased by the stress on families.
Yeah, that's very important. Telehealth was actually, there were a couple of questions about that, about sites or resources that can be used via telehealth. We've listed some in the resource list, but you may have some more. I think the one we have listed, Christopher, is one that you sent to us. So it's a compilation of a lot of different types of resources. But anything else around telehealth?
Well, I think we'll make sure that we include a whole resource list, as well as the transcript from the chat box, the themes that folks have raised, and have any resources that they've shared. And we'll make that available to all the people who have registered for today's webinar.
Oh, Crystal just added, it's Counselor Awareness Month, and the theme is Burn Bright, Not Out, which is, I agree, totally relevant right now.
Yeah, that's good.
Exactly.
Avoid that.
Right.
Yes.
Yeah.
Do we have time for one more question?
Disparities has also come up. Just wondering about, is there going to be any flexibility to creatively address that? That's something that has come up on a regular basis. It's so clear now where those disparities are. Any comments about that? I know Christopher talked about it being a good time for advocacy, and also Liz said, keep up with the data around this. Anything else?
Well, I think we are just starting to get some epidemiological data that African American and perhaps also Latino families or individuals are more at risk of developing COVID, which may be related to underlying health conditions, living in close proximity in urban settings, So we don't know exactly why that would be the case. But again, it does seem like in so many ways, the most vulnerable among us and the most disenfranchised and the most discriminated against are bearing an unfair burden from this pandemic. And so again, rather than see that just for what it is, which is horrifying and awful, I think we should take from that energy to mobilize advocacy. It is an opportunity to insist that our healthcare system be something that is equally accessible by all of us. And thinking about the ways in which we should be able to support families who are the most vulnerable and the most in need in our society.
For sure. Yeah.
So we only have just a couple of more minutes left, and I am not seeing any other questions.
And I would like to say a giant thank you to everyone who participated today, whether you were a presenter or not. You certainly have put out more information than the rest of us did. In the chat box, we've got a wealth of information, and I cannot thank you enough. We really appreciate you taking the time to do this and hope it was valuable to you. Thanks.
And we don't know how long this will go on, but the TA network and Fredla and all the people here on the panel and, will be with throughout as needed. And it's hard to imagine that, I think Dr. Fauci has said this many times that, there's going to be a new normal. And so I think together we're going to figure out what the new normal is, and in that context, how we can support families in a new way.
Thank you, everyone. This is Denise Solsback. We are truly stronger together, and we really appreciate your participation. And thank you to our presenters. Take care, and please join us again.
Thank you.